Hey, I'm Dr. Tom Schell with D.V.M Veterinary Research and also SecondVet.com. I wanted to take this opportunity this day to just kind of get on the soapbox here shortly, or for hopefully a short period of time, and talk to you guys about medications, pharmaceuticals, if you will, versus herbs and food. Why would we choose one over the other? I'm in my laboratory as we speak right now, and you can see behind me on the windowsill is all of my staining supplies that I do a lot of cytologies and handwork underneath a microscope looking at all sorts of specimens. As I pan around me, you can see the cabinet to that side that's open is my pharmaceuticals. And there's not a whole lot in there. As you can see, there's not a whole lot, but in truth and reality, there's not a whole lot more there now than what there was 18, 20 years ago when I was clinically practicing and doing surgicals and colics and intensive cares. And the other cabinet to the other side is my surgical supplies. Camera throws you off here a little bit. But pharmaceuticals are great. There's a time and a place for pharmaceuticals, and I was able to get by with a very small pharmacy because mainly we use generics to keep price down. And generics were available because the medications we have been using or were using have been around for eons. They're trusted. It's kind of like a car. It's a model that's been around for decades, and this thing works. And you can count on it. Times have changed. But we didn't require a whole lot in terms of fanciness, in terms of name brand medications. I think maybe we had one or two, quote unquote, branded medication. And I think that was for use in dogs, a non-steroidal. But it's probably not even on the market anymore. But we do have medications, and there's a time and a place for them. This one here, Panicure, fenbendazole. Most horse owners know what the hell that is, right? That's a dewormer. It has a specific action to it, specific time and a place for it. We use it short term to get a horse over a worm burden. And if need be, if they continue to have a high worm burden, we dig deeper. We try to figure out what the hell's going on, right? Why is it? Is it an immune response in the horse? Is it pasture, poor maintenance, lifestyle? What is it? We're not going to keep just giving them a dewormer. You don't do that. We're doctors, we're scientists, right? Antibiotics, sulfatrimethoprim or SMZ-TMPs. Most horse owners know what that is too. Specific time and a place for that antibiotic. It gets certain groups of bacteria, generally gram-positive, gram-negative, aerobic bacteria, and we use that. It's time and a place for it. We don't run it chronically. We would run it for 7 to 10 day course for infections in horses. Things like lidocaine injection. Time and a place for it. Local blocks, nerve blocks, sewing up lacerations, things along those lines. Dexamethasone, time and a place for it. Anything from allergies to acute inflammatory responses, time and a place for it. Gentamicin, generic. Can still get this today, by the way. Fantastic antibiotic. IV use or IM use only. We use that in our hospital all the time. Neonates and adult horses, colics, septicemias, infections, lung infections, pneumonias. There's a time and a place for that antibiotic and a specific group of bacteria that the antibiotic gets. I'm not going to run it chronically, but we use it as needed. Metronidazole. This is an oral. This is a human formulation, 500 milligrams. Either way, it's still sitting on my shelf. Time and a place for that. Great for anaerobic bacteria, abscesses, wounds, things along those lines. Actually, in horses, I would use that metronidazole to theoretically, empirically diagnose IBD in horses because metronidazole has got a secondary benefit that it is an anti-inflammatory to a certain extent. So it would help me to rule out some sort of inflammatory condition in their gut. If they responded, did I use it chronically? No. We dig deeper. We're scientists. We're doctors. But the whole point is with every one of these medications, these things work in the body physiologically on some level. They're impacting some sort of cellular process. The corticosteroid dexamethasone, I keep looking down at my medications here. It works specific means. It has a certain impact on the physiology of that horse. Low doses, we can reduce inflammation. High doses, we can shut down the immune response. If you're not careful with that medication, you'll induce laminitis in a horse very, very quickly and easily, especially in EMS horses. This is why I caution horse owners with, that have got EMS horses or horses that are overweight about injecting joints because those guys are just taking vats of inflammation. And you're just waiting for a corticosteroid to push them over the edge, which I've seen 1,000 times. And you push them over the edge and induce laminitis or some other health problem in that horse, and it's iatrogenic. You did it. Veterinarian did it because we weren't paying attention. But all these medications works by specific actions. The antibiotics, they get specific bacteria through specific pathways to impact that bacteria, keep it from replicating, keep it from absorbing a certain nutrient that it needs to survive. They have specific pathways as to how each of these medications work. So how do we come up with these things? Well, every one of these medications is generally based on some sort of research that was done with a food or an herb and seeing how it impacts bacteria or how it impacts a certain pathway physiologically in the body. And instead of just saying, hey, great, this herb works, we don't like that because there's not a whole lot of profit in that. We want to create something. So they will take what that herb does, they'll research it a little bit further, try to isolate that pathway as to how it's doing what it's doing, and they will create a pharmaceutical off of that. So if I sit there and say an herb like turmeric with curcumin, which is the active ingredient, is a potent anti-inflammatory, it is very, very potent anti-inflammatory. So if we do research on that, we find out how it's inhibiting, NFKB and how it's impacting that inflammatory pathway, we can isolate that mode of action, if you will, and then come up with a pharmaceutical from something like dexamethasone to the more potent anti-inflammatories that are out there, from phenylbutazone to Celebrex, which used to be on the market, and all your other COX-1 inhibitors. We can come up with all of those based on that pathway that we just saw with turmeric. What's the downside? Downside is that the more you focus on that pathway, specifically just that pathway, which is what these medications do, they all focus on a specific pathway. They target it, very concentrated. The more you focus on that one pathway, the more you're going to end up with side effects. Why? Because in a lot of cases, you're inhibiting things that the body needs otherwise. So if we take, for instance, in the antibiotics, so we have, amoxicillin. Surely everybody's familiar with amoxicillin, especially if you have kids, right? Ear infections, strep throats, things along those lines. If you look at that antibiotic, or any antibiotic, it can be SMZ, TMP, you're going to run that trying to conquer sinus infection, say, for instance. But you're not just impacting the sinus. You pop that in your mouth, you swallow it, you're impacting the microbiome in the gut throughout the entire body. Every body cavity, skin, boom, 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 but you're hoping that you're going to get the sinuses. And maybe you do, maybe you don't. But you've impacted a crap ton of other things in the body. Not necessarily a bad thing, but we deal with the side effects of that. Can you imagine chronicity and the long-term usage of those medications and what it's doing? Not a good thing. So when we look at herbs and food, again, as doctors and scientists, we start to hopefully connect dots. So instead of taking that horse, say, for instance, with Cushing's or PPID and metabolic syndrome, we start to, be the scientists we are. We start to dig a little bit deeper, trying to figure out what's creating this cellular problem in this horse. And it's something like Percend, or cyproheptadine, which was another drug. Are these things really tackling the problem? Are they curing it, or are they more palliative at best? And I say I vote for palliative at best. And are there side effects? Oh yeah, there's a ton of side effects. But yet we continue to contend with this. Instead of digging into it and saying, hey, this is an overweight horse. It's got metabolic syndrome. Maybe the insulin levels not as high as what we think that it should be for an insulin-resistant horse, but it's getting up there. So maybe we start to look at that. Maybe we start to look at the oxidative stress testing in these guys. Maybe we start to look at the microbiome in their gut and their poop, and we start to connect the dots. And if you start to connect the dots, then you can kind of start to see how food, herbs, things along those lines with minimal to no side effects, when used properly. And even if there are side effects, you can quickly eliminate those within 12 to 24 hours just by stopping what you're doing. This is how we learn. But side effects with medications that are sitting here next to me, can be pretty disastrous, and as I attend veterinary conferences, I think I said in another video, I get easily spooked by what I'm seeing coming up. And at a conference here recently, I sat outside of a conference hall just drinking my coffee, looking in through a door, watching a topic of feline atopy or atopic dermatitis. And I'm thinking back to when I was in practice clinically, and I was able to manage these guys with diet and, worst case scenario, very, very mild corticosteroid, maybe once a month, best. And these guys did great. And now, for some reason, that doesn't work anymore. And we're using these very, very potent, what's called as JAK inhibitors or these anti-inflammatories that are shutting down the immune response. So worst case scenario that I had side effects is maybe a topical infection that came up because I was suppressing the immune system just a little bit. But now, because of our dependence on drugs, our side effects list is getting a whole lot worse. And when I start seeing up on these slides and projector screens that death is a common side effect with these medications, that's a cause for concern for me. When I see in horses what's called as the percent veil, I think, which is a term that the horse owners have used for these Cushing's horses on medications, I have to step back as a doctor and sit there and say, well, what's creating this? And if that side effect is happening, why aren't we stopping that and stepping back from it and looking and evaluating what we're doing? Maybe the horse truly isn't Cushingoid. Maybe this is the wrong approach. Maybe we should do a different approach. But herbs and whole foods, to me, discovered it a long time back and started to use it in our patients. And even if I had to resort to medications, which is not uncommon, it's in the short term. And then as that horse was discharged from our hospital, as that dog was discharged from our hospital, we had a plan of attack. We were going to change diet, we're going to change lifestyle, we're going to incorporate some herbs, and we're going to get that horse or that animal healthier. And that's what it's all about. If we have a state of disease, then the body's out of balance. The body's not healthy. The goal is to get the body back to a state of health. The question is, what the hell created that state of lack of health? And that's where the inquisitiveness, that's where the doctor comes in, that's where the scientist comes in, and that's where you as a horse owner or the pet owner come into play. We all have to put our heads together to try to figure these things out, but the answer is there. But whether if you choose pharmaceuticals and choose not to ask questions, but then maybe complain about the side effects that's going on, or whether if you choose to explore things like proper diet. And, there you got to be a little bit careful about who you're taking information from in this world today. But you do have a choice, and the choice is always there. Just may not be the most convenient or the one that is most popular. But you always have a choice. Take care.